Right here, we have our hand exoskeleton system. There's actually no motors, no electronics in this whatsoever. It's purely human powered, and it operates by air and water. So say I've had something like, unfortunately, like a stroke or something like that, where I've lost the use of one hand. The idea here is I can put on both of these gloves and I can actually rehabilitate myself. Or a therapist can wear one of these gloves and then they can sort of help teach you how to do a movement or rehab. And so those three fields, sort of the clinical, the basic science, myself, and the engineering converged, and then that led to this sort of development.
There we go. So I've really enjoyed stepping into research in this lab with CJ in that we have kind of worked mostly at a basic level. So by working with people with typical nervous systems and musculoskeletal systems, we can do fun things like probe the way that they learn, make challenging tasks for them, potentially turn types of impairments on or off, and explore the way that healthy individuals would naturally adapt to these kinds of scenarios. So specifically with my dissertation work, I'm really curious at investigating how humans interact with each other, because in situations like rehabilitation to walk after a stroke or a spinal cord injury, it's incredibly effortful, not only on the patient's effort and side of things, but also on the clinicians. So because it is so much work for a clinician to assist someone who has high levels of impairment to actually do something like walking, I'm very curious to improve that experience for both patient and clinician. And I think technology can be a good approach to trying to answer some of those questions. And if you are interacting with a therapist that isn't really showing that they're invested in your progress or the goals that you're interested in, you might not feel necessarily as willing to do the hard things, like more exercise or more walking, or try a little bit harder to take a step. But if it looks like your therapist really truly cares about you being able to achieve the things that are important to you, I feel like that can be a huge motivator for people to actually make the progress that would otherwise seem impossible.
What really makes her work stand out is that she's brought in this psychology component, where so far I haven't really delved into those aspects, but it's been missing from a lot of the current motor control, motor rehabilitation studies, which sort of almost are sanitized in some way. Like here, like I'm in this lab, everything's very well controlled, but when you go into real neuromuscular disorders, it's very complex and messy. There's pain involved. Often there's a lot of psychological components that you want to consider that I don't think have been considered, especially how they relate to motor learning and motor control and rehab. And so that's exactly what her research is opening up. So in this space of rehabilitation, it really sort of takes that interdisciplinary view to try and tackle some of these questions.